thank you for joining us for the 2025 International Foundation for Gastrointestinal Disorders Advocacy event. The International Foundation for Gastrointestinal Disorders, also known as IFFGD, is an international nonprofit organization that works to enhance the lives of those with gastrointestinal disorders. We do this through research, community, education, and advocacy. Today, our program is focused on advocacy, and we're thrilled that you are able to join us. My name is Cecile Rooker. I'm the President and Executive Director for the International Foundation for Gastrointestinal Disorders. I am also a patient with 3 GI conditions. I have 3 children, 2 of which also have GI disorders. I appreciate the fact that you are able to join with us today, and I hope that in some way we will be able to educate you on things going on in Washington, but also give you some resources that can help you on your journey. Today's program is brought to you by IFFGD, but we're able to bring this program to you through the contributions from Pfizer, Takeda, Fathom, Sabella, and Ardelyx Pharmaceuticals. We appreciate their support of this program, although none of the content has been influenced by them in any way. So today our program is focused on advocacy. We're going to have 3 sessions today. Our very first session, we're going to explore one of the most important governmental agencies that we have for the illness community overall, and that's the National Institutes of Health. The NIH is a global leader in medical research and has been for a very long time. So today we're going to talk to you about 2 of the institutes or centers within the NIH. First, we will have Dr. Griffin Rogers from the National Institute for Diabetes and Digestive and Kidney Diseases, the NIDDK. The NIDDK works to create knowledge about and treatments for diseases that are among the most chronic and costly for patients and their families. Many of those are digestive diseases. Some of those are for kidney. They cover a wide swath of very important research, and it is led by Dr. Griffin Rogers. He has been the director of the NIDDK since 2007, but has been with the NIDDK in a leadership position since 2001. Prior to joining NIDDK, he is widely recognized for his contributions in research for the development of the first effective and now FDA-approved therapy for sickle cell anemia, and was a principal investigator in clinical trials to develop therapy for patients with sickle cell disease. We're really lucky to have Dr. Rogers with us today to give a talk about the NIDDK. What he's going to do is give you an overview of the NIDDK, what it does, and some of its programs. Following Dr. Rogers, we are thrilled to have Dr. Helene Langevin from the National Center for Complementary and Alternative Medicine, or the NCCIH. The NCCIH is the center at the NIH that oversees research on the fundamental science, usefulness, and safety of complementary and integrative health approaches and their roles in improving health and healthcare. Dr. Langevin, prior to coming to the NIH, was the director of the Osher Center of Integrative Medicine, jointly based at Brigham and Women's Hospital and Harvard Medical School in Boston, Massachusetts. She was also professor in residence of medicine at Harvard Medical School. Prior to that, she was a professor of neurological science at the University of Vermont, Larner College of Medicine in Burlington, Vermont. We're super thrilled to have both Dr. Rogers and Dr. Langevin here with us today to give us an overview of 2 very important institute and center at the National Institutes of Health. Please welcome them as they give their talks, and I'll see you after.
Hello, I'm Dr. Griffin Rogers, Director of the National Institute of Diabetes, Digestive, and Kidney Diseases at NIH. Thank you for the invitation to present at the 2025 IFFGD Education and Advocacy event. IFFGD and NIDDK have a long relationship working together to advance research and to find ways to improve the lives of those with digestive diseases and disorders. In fact, I'm grateful to IFFGD's president, Cecile Rooker, for her years of service as a member of NIDDK Advisory Council. I'd also like to thank the IFFGD advocates for your tireless dedication to champion support for this research. I'll first provide some background to tell you about how NIDDK fits into the larger NIH landscape. And then I'll discuss NIDDK supported research activities to showcase how we are advancing research on digestive diseases as an important component of NIDDK's mission. To start with some background, the National Institutes of Health is the nation's biomedical research agency, supporting thousands of researchers. The role of NIH in achieving these goals is to support discovery of new knowledge and to see that knowledge translated into practice. More than 80% of NIH's funding is awarded through almost 50,000 competitive grants to more than 300,000 researchers at more than 2,500 universities, medical schools, and other research institutions in every state in the U.S. About 10% of NIH's budget supports projects conducted by nearly 6,000 scientists in its own laboratories, most of which are on the NIH campus in Bethesda, Maryland. NIH includes 27 institutes and centers, including NIDDK, and is a component of the U.S. Department of Health and Human Services. NIH is the primary federal agency conducting and supporting basic, clinical, and translational medical research and is investigating the causes, treatment, and cures for both common and rare diseases. NIDDK's mission is to support and conduct research to combat diseases such as diabetes and other endocrine and metabolic diseases, liver and other digestive diseases, nutritional disorders, obesity, kidney, urologic, and hematologic diseases. Many of these diseases within NIDDK's mission, including digestive diseases, are some of the most chronic, common, consequential, and costly conditions affecting Americans today. And as you all are well aware, digestive diseases can affect people at any age, resulting in a lower quality of life, years lost due to premature death, and costs associated with hospitalizations, medications, and surgery. This underscores the importance of supporting research to combat these diseases throughout the lifespan. NIH's ability to fund research is in the context of a flat budget is under pressure from several factors, including the large number of applications we receive, rising cost of awards, and our effort to support the workforce pipeline through special early-stage investigator pay lines and new policies to raise pay for postdocs. At NIDDK, we have to balance these complex factors across a multitude of research areas within our mission to optimize our support for the science and for the people who make it happen. Along the winding road of our Institute's long history, we've gone through our share of changes in name and scope. And we've supported some key efforts to advance digestive disease research, including establishing the Digestive Disease Research Centers and overseeing strategic planning efforts to prioritize and catalyze this research. Now, you may have noticed a 75-year logo on my slides. That's because 2025 is an important year for NIDDK. This year, NIDDK celebrates our 75th anniversary. This occasion allows us to reflect on the incredible progress that has occurred over the last 75 years toward understanding and treating our mission diseases, while it also encourages us to imagine how much more we still can achieve. It also gives us the opportunity to celebrate the many people who've made possible our contributions to science, research, and health. For example, the digestive disease space, NIDDK-funded researchers have been exploring the genetics, microbiome, and clinical outcome of people with inflammatory bowel disease, spearheading the efforts to move toward more personalized approaches to treatment. We're also grateful for the countless number of volunteers who participate in NIDDK-sponsored clinical studies, like the Gastroparesis Clinical Research Consortium, which has assembled the largest registry of people with gastroparesis in the world. We view this moment as an opportunity to build on past advances, and we'll continue to be guided by our commitment to engage community members in our studies, to leverage new technologies to enable more informed care, to harness the promise of big data and AI to improve research and to inform better healthcare, and to train and support the next generation of researchers. I encourage you to visit our NIDDK 75th anniversary website that will feature evolving content that tells the story of NIDDK and how we are continuing our efforts to advance research and health for all. Now that I've given you a brief overview of NIH and NIDDK, I'll drill down a little deeper and give you some more examples of how NIDDK is working to better understand and treat disorders of the digestive system. You can see in this chart that support for digestive disease research is spread across many NIH institutes, centers, and offices, including NIDDK, the Cancer Institute, and the Allergy and Infectious Disease Institute. And despite budgetary challenges, NIH remains committed to supporting this research. NIDDK's Division of Digestive Diseases and Nutrition supports a wide breadth of basic and clinical research, including studies to understand and treat disorders of the gastrointestinal tract. It also supports training and career development programs to bolster the scientific workforce and research centers that provide resources and support pilot and feasibility studies. This slide highlights some of the current digestive disease research program overseen by the division, like the Consortium for Gut-Brain Communications in Parkinson's Disease, in which NIDDK, in partnership with the National Institute of Neurologic Disorders and Stroke, aims to address the role that the gut plays in neurologic disease. Other studies include the FIT study, which is comparing the effectiveness of two treatments for fecal incontinence, and the CAMEO study, which is investigating why a common treatment resolves gut inflammation in some children with Crohn's disease, but not in others. I'll go into details on several more clinical studies in a moment. But I'd first like to share with you just some examples of recent scientific advances resulted from NIDDK support. A new understanding of how the digestive workload in a small intestine is divided along its length. The uncovering of genetic risk factors that disrupt intestinal healing. Insights into the association between adverse childhood experiences and irritable bowel syndrome. The development of a new, more accurate laboratory model for celiac disease. And other advances, such as understanding childhood diarrhea treatment, determining how diet affects health, and discovering how the community of microorganisms in the gut impact metabolism and inflammation. All of these advances, and many others supported by NIDDK, promise to give valuable insights to help us understand diagnosis and treatment of disorders of the digestive system. Now, clinical trials complement digestive disease basic research and are all at the heart of all of our medical advances. The Division of Digestive Diseases and Nutrition has several mechanisms to support clinical trials, including NIH research project grants to investigator-initiated studies, NIDDK small research project grants for pilot studies, cooperative agreements for investigator-organized multi-center trials, and funding opportunity announcements for NIDDK initiatives, and awards to support trials in small businesses. And we also joined funding opportunities from the NIH Office of the Director and other institutes on a case-by-case basis. Now, on the right, you'll see a few of our digestive disease research studies consortium that incorporate clinical trials, including SERVENT trial, which is testing whether a procedure can prevent precancerous changes in the esophagus for people at risk for esophageal cancer, and the GLUTEC trial, which is assessing the use of novel gluten detection technologies for the treatment of celiac disease. NIDDK is also supporting a trial to examine the effectiveness of hyperbaric oxygen therapy as a treatment for ulcerative colitis. And I already mentioned the Gastroparesis Clinical Research Consortia, or GPCRC, which also conducts clinical trials to test therapies for gastroparesis. NIDDK also plays an instrumental role in advancing cross-disciplinary research areas relevant to digestive diseases, such as nutrition research, and played a key role in developing the strategic plan for NIH's nutrition research by the NIH Nutrition Research Task Force, chaired by myself and co-chaired by the directors of the Heart, Lung, and Blood Institute, the Cancer Institute, and the Child Health Institute. The NIH Office of Nutrition Research is coordinating implementation of this strategic plan by NIDDK and other institutes, centers, and offices. The implementation includes the Nutrition for Precision Health Study, part of the All of Us program funded by the NIH Common Fund, which is enrolling a targeted 10,000 participants at 14 sites nationwide. NIDDK staff are continuing to participate in thematic NIH nutrition science working groups, such as ones focusing on the topic of food as medicine, microbiome, and the ultra-processed foods. In closing, I would again like to thank IFFGD for this opportunity to share with you some of NIDDK's accomplishments and ongoing activity that we're working towards better treatments and ultimately cures for digestive diseases. I invite you to visit our website for more information on NIDDK's activities and to connect with us on social media.
Hello, my name is Hélène Langevin. I am the director of the National Center for Complementary and Integrative Health at the National Institutes of Health. And it's my great pleasure to talking about connecting gastrointestinal health to whole person health, which is whole person health is the central theme of NCCIH's current strategic plan. So I'm going to start by telling you a little bit about that, and then we'll connect it to gastrointestinal health. So what do we mean by whole person health? Whole person health is kind of an effort to correct a tendency that we have in medicine, long-standing tendency going over a century, to compartmentalize the body into different organs and systems. See here, cardiovascular system, the neuroverse system, the gastrointestinal system, etc., musculoskeletal. And this compartmentalization is really driving a lot of our healthcare specialization. And it also means that when we treat diseases, we tend to treat them separately, using, or for example, medications that are targeted at specific separate problems of, say, for example, the heart, stomach, the joints, for example. And people end up taking sometimes a lot of different medications for their various different problems. But another way to think about this is that there's a lot of factors that are that sometimes precede the development of diseases that are common to many of the chronic diseases that afflict people. For example, chronic stress, poor sleep, poor diet, sedentary lifestyle are predisposing factors for many, many different chronic diseases, including diabetes, cardiovascular disease, and some common gastrointestinal disorders. So we're going to be zeroing in a little bit more on that in a minute. But I also want to really talk about another very important component of whole person health, which is the idea that diseases don't develop suddenly. Typically there's a period of time where an individual can go from being healthier to less healthy and finally develop being diagnosed with a disease. So there's a period of time where abnormalities or problems are starting to happen that have the potential for being reversible. And this is where addressing these predisposing factors, such as the chronic stress, the poor sleep, etc., can be really important because it allows us to potentially revert these abnormalities before there's, for example, end organ problems that are irreversible. So what are the types of things that we can do for chronic stress, poor sleep? For example, there are psychological methods that we have to address stress, nutritional interventions for poor diet, and physical interventions for and helping people to be more physically active without injuring themselves. All of these types of interventions can be combined with self-care in order to support a healthy lifestyle. And this is what whole person health is all about. So I'm going to be talking about stress I'm going to emphasize stress particularly in this talk, because this is perhaps one of the more under-recognized problems underlying a lot of the chronic conditions that we see. And we know that people, especially in the United States, are under very high levels of what we call chronic stress. Acute stress is when you have something that happens, very quickly. You're exposed to something that like a trauma or something like that. That's not what we're talking about here. We're talking about chronic stress that goes on for weeks and months and even years. And we know that in the US, people have some of the highest levels of stress in the world, according to many surveys. So what does chronic stress do to the body? Well, chronic stress can have an effect on many, many different organs and systems. But now I'm going to be specifically talking about some of the effects that chronic stress can have on the gastrointestinal system. And we know that chronic stress, is associated with many different diseases of, for example, gastroesophageal reflux disease, irritable bowel syndrome, inflammatory bowel disease, peptic ulcers, functional dyspepsia, and even food allergies. So it's worth taking a moment to really think about what are the effects of stress and how can we counteract them. So if stress is having such an effect on these problems, well, it would make sense that reducing stress may help. So I'm going to show you a little bit of some evidence of that. So there is a technique called mindfulness-based stress reduction. This is a technique that uses a form of, it's derived from meditation, but it's been adapted many, many different ways. You can do it using an app on the phone or online. It has to do with helping people become more aware of the types of reactions that they may be having in times of stress, and to interrupt these kind of reactions that people have by relaxation, breathing techniques, for example. Focusing on the breath is very, very useful, and it allows people to turn down the dial essentially on their stress response in real time, right away. And these types of techniques can be very, very helpful. So this is an example of the mindfulness stress-based reduction that was used for people with irritable bowel syndrome. And what they used here is this IBS severity scale. And you can see here that people were randomized to a group that was taught how to do the mindfulness practice, and a control group that was a support group. And you can see that there was a clinically significant difference in the groups at post-treatment, but also at the 3-month follow-up, which indicates that this was an intervention that people learned something that they were able to continue using, and that was beneficial to them. Now, how would this work? Why would it be that practicing mindfulness could reduce symptoms of irritable bowel? Good question. So here's a study that is already now several years old. It was from 2012, but it's nice because they really use a well accepted model of what we call psychosomatic kind of type of pathophysiology, where there are hypothesized relationships between the reactivity to the stress, but also what we call visceral sensitivity, paying attention and reacting to the sensations that people are getting from their internal organs, in this case, their gut. And there were some positive associations between the reactivity and the IBS quality of life and severity scores. So this is one way to think about it, in terms of there's this kind of a conversation between the brain and the organs in terms of perceiving the sensations, but also presumably, and hypothesizes that the mindfulness interrupts some of the autonomic nervous system reactivity that goes on while this is happening in both directions, both ascending and descending. But we're starting to realize since then that the conversation between the brain and the gut is a lot more complicated. And that stress can have effects not only on the visceral sensitivity, but also, and gut motility, but also on other aspects of the gut that we're just starting to really understand better, such as the microbiome, as well as permeability and inflammation. And the idea is that some of the stress may be having an effect on many different aspects, even beyond that. So here is a kind of a little snapshot of what we're thinking now in terms of the relationship between the microbiome, inflammation, and what we call the gut-brain axis, where the composition of the microbes that are in the gut can have effects on some of the substances, for example, that these microbes may secrete, or that the body will manufacture in response to the different types of microbiota that are in the gut, may contribute to the altering the permeability of the gut barrier, and allow some dysregulation of immune traffic across the bowel wall, which is normally very tightly regulated, and that this can lead to systemic inflammation that can reach other organs. And one of the organs that has been studied the most in this case here is the brain, the nervous system, in relationship to what's going on in the gut. It's likely that it's affecting other organs as well. But there's well-documented effects that can reach the brain in terms of neuroinflammation that are related to what's going on in the microbiome of the gut. And so the idea is, okay, if that's the case, then what about using the mindfulness in based stress reduction in the case of a dysregulated microbial or inflammatory condition? So here is a study where of people with Crohn's disease, where there is a significant changes. Normally, I mean, in pathophysiology of the condition, we know that there are problems with both inflammation as well as microbial dysregulation. So this was a study where the mindfulness-based stress reduction was used in conjunction with an exercise, a physical therapy. And you can see here that this is a very complex analysis of the interrelation between the factors, where purple are the psychological factors, yellow are bacterial, and orange are inflammatory. And the what we call the edges or the lines that relate these factors are either representing significant positive or negative correlations, depending on whether the lines are green and or red. So this is just to show you that this is the kind of studies that we're now able to do, because not only do we have the tools to measure all these factors, but we have ways that we can analyze how all of these different factors are interrelated in a network kind of way. And we're able to see, for example, how applying, in this case, something like mindfulness can modify the relationships that are among all these variables. In this case, what they found is some associations between what's going on in the psychological realm with the inflammatory realm and the microbe composition. So, and finally, I want to make a very, I think, which is one of the most important take-home lessons here, is that it's unlikely that, because as I said at the beginning, all of these factors, diet, sleep, physical activity, they're all part of a network. And it makes sense that components of a healthy lifestyle, including all of these components together, may be more important together compared to one at a time. And I think this study illustrates this. So this is a study that used the UK Biobank data, and they looked at people. This is an observational study. It's not a randomized trial, but they looked at the association of people with IBS and people who either smoked or didn't smoke, people who had good or poor sleep, levels of physical activity, moderate alcohol intake, high dietary quality, and also, importantly at the bottom, people who had 3 to 5 of these healthy lifestyle behaviors. And you can see that one at a time, there are small effects in the direction of being beneficial. But when you combine 3 to 5 of these healthy lifestyle behaviors, the effects become stronger and more significant. So this is important, because it really is what whole person health is about. It's about looking at the whole person and really supporting whatever the person needs the most at any given time, paying attention to all of the various different aspects. Say, for example, one person might have more difficulty, for example, with sleep at any given time. Addressing that first may help them to get more sleep, to feel better, and then once they have more energy, might be able to spend more time exercising, for example, or have more energy to go and buy and cook healthy foods, and then improving their diet. So it's really a matter of meeting people where they are, and but also addressing all the various parts of the person as needed. So support for healthy lifestyle is something that we don't do optimally, really, in our current healthcare system, and we really need to improve how we address this in order to be able to help people reverse and prevent, and also reverse some of the chronic diseases that people are experiencing, including gastrointestinal diseases. So, in summary, the way we define whole person health at NCCIH is empowering individuals to improve their health in multiple interconnected domains, including biological, behavioral, social, and environmental. Now, I didn't talk very much about the social and environmental domains in this short talk, but they're clearly very important because if people are going to be kind of empowered and supported to, for example, improve their diet, they need access to healthy foods. if they're going to be getting more physical activity, they need some safe spaces, to go and exercise and walk around outside, for example, place. And so factors like air pollution, for example, can be detrimental. So it's really paying attention to the whole person at the individual level, as well as the social and environmental level. So I thank you for your attention, and I wish you a good rest of the meeting.
Hello and welcome back. I am Cecile Rooker. I'm the President and Executive Director for the International Foundation for Gastrointestinal Disorders. And today we are in the middle of our 2025 Advocacy event. Thank you for watching, and we hope you enjoyed the two talks from Dr. Rogers and Dr. Langevin from the NIH. In this next session, we're going to talk about different resources that you have as patients with other nonprofits. There are many nonprofits out there today, and there are some that are specifically focused on the gastrointestinal illness community. Today, we're going to highlight just two of them. The first one is the Association for Gastrointestinal Motility Disorders, or AGMD. It was incorporated in 1991, which is actually the same year as IFFGD. They focus on digestive motility diseases and disorders. But unlike IFFGD, they provide a forum for patients and their families in a support setting. They have support groups, both mostly online now. We're really thrilled to have with us the founder of AGMD, Mary Angela DiGratitucci. AMGD was founded by Mary Angela, who after many years of misdiagnosis, which I know you can relate to, she was finally found to have chronic pseudo-idiopathic pseudo-obstruction. Over the years, her disease progressed, and eventually her entire digestive tract left her with gastroparesis, diffuse esophageal spasm, achalasia, GERD, dysphagia, esophagitis, and so many other diseases and mental conditions. So she decided to advocate for herself and started AGMD so others could join her and walk with her through this journey, and that she might be able to help others after suffering the way she did. She's going to give you a great overview of what they do, who they are, how they started, and how you can get in touch with them if any of the programs they mentioned are of interest to you. After Mary Angela, we have a new friend of mine, Stephanie Wynn. Stephanie Wynn started the Stephanie Wynn Foundation in 2021. It is a nonprofit organization that helps people with inflammatory bowel disease, specifically Crohn's disease. Now, IFFGD does not deal specifically with Crohn's disease and education around inflammatory bowel diseases, but we know that many of you have overlapping conditions, and some of the information that she has and resources that she shares is applicable not only to the IBD community, but also those of us with functional motility disorders as well. The mission of the Stephanie Wynn Foundation is to advance health equity and eradicate healthcare and financial disparities in underserved African American and marginalized communities suffering with inflammatory bowel disease, particularly ulcerative colitis and Crohn's disease. They do this through targeted education outreach, financial literacy programs, and food security programs. Most recently, Stephanie published a book. It's called Navigating Inflammatory Bowel Disease, a 6-week blueprint for better gut health. And it's more than just a book, it's a lifeline. In this resource, she shows people in 6 weeks how they can better advocate for themselves in their medical journey. It's a resource that can be applied to many of us with GI disorders, and I hope that you will take a peek at both of the websites for both AGMD and the Stephanie Wynn Foundation following this program. But for now, I will leave it to Mary Angela and Stephanie to tell you more about what they do. If you feel that these programs might be a benefit to you, check them out.
I'd like to thank the IFFGD for this wonderful opportunity to talk a little bit about the Association of Gastrointestinal Motility Disorders, also known as AGMD. My name is Mary Angela DiGratitucci. I'm a longtime patient with digestive motility disorders, and I also am humbly honored to serve as a volunteer for a nonprofit organization. First, I'm going to talk a little bit about AGMD, the history of it. I'm going to talk a little bit more about the advisory board, our support group meetings, education, our email magazine, inspirational interviews, advocacy, awareness programs, resources, closing remarks, and then how you can get in touch with us. AGMD was incorporated in 1991, the same year as the IFFGD was incorporated. We're an international nonprofit organization, and we're one of the oldest organizations in existence with a focus on GI motility disorders. Our organization brings together a diverse group of individuals, patients, family members, physicians, nurses, basic science and clinical researchers, pharmaceutical and diagnostic professionals, home healthcare workers, dietitians, biotech industrialists, other organizations, and those in the community who are interested in GI motility disorders. We provide a variety of resources and programs centering on education, the dissemination of information, advocacy, outreach, research, and support. In 1997, we held our first symposium on GI motility disorders. We featured a distinguished panel of experts alongside patients, family members, friends, and members of the medical and scientific communities. AGMD had hosted these symposia over the years, partnering with the University of Kansas Medical Center of Continuing Education to provide these continuing education credits. And the AGMD Symposium have received the prestigious endorsements of both the American College of Gastroenterology and the American Neurogastroenterology and Motility Society. In 2016, we held our first Digestive Motility Patient and Family Conference in Bedford, Massachusetts. World-renowned speakers in the medical and nutritional community spoke along with patients and family members. The conference marked our 25th year in existence and was a tremendous success. We provide a form of support for patients and families suffering or impacted from GI motility disorders. We also function as a clearinghouse for members of the medical, scientific, and nutritional communities, and we serve as an educational resource for GI motility diseases and disorders. We provide also a database of neurogastroenterology and motility specialists, as well as motility centers and clinics. We have world-renowned experts who serve on our medical, scientific, and nutritional advisory board. Some of the doctors or medical experts who were with us in 1991 have stayed with us on our advisory board, which we are ever so grateful for. And we keep on adding new ones to our board as well. These advisory board members are very active in participating and helping us organize some of our conferences and in the past symposium. AGMD holds virtual educational support group meetings. Typically, they occur every month, and we call them educational support group meetings because we learn from each other as patients and family members. And it's amazing how, and it always humbles my heart, seeing others who are going through these changes in their life impacted by GI motility disorders and how they're willing to help others and hold each other up with their suggestions, tips, and support. And of course, we do offer individual one-on-one support for those who are in need of that one-on-one support. And sometimes patients may be unaware that we have these meetings. So it can be an introduction as to what our organization offers and then how they can participate in these groups. Our programs, all our programs, are also typically recorded. So those who are unable to participate, they can always listen in later if they're hospitalized, if they're working, or if they're just not feeling well that day, have doctor appointments, whatever it may be, it enables them to have access to these programs when they're unable to attend. Some of the things we talk about in these meetings, relationships, where some grow stronger and some break apart, the social impact, where there may be isolation, bathroom issues, food issues, financial issues, job loss, escalating medical costs, household costs, coping, learning to cope with everyday life, having these GI motility disorders, the emotional roller coaster that goes along with enduring the suffering of motility disorders. And I can't stress this enough, is the communication part, how to talk to your relatives or partners or spouses, your family, how to talk to your coworkers, how to talk to your friends. If you're dating, how much do you tell? How do you tell it? Who do you reveal to? So that communication is key, how to talk with doctors, how to talk to nurses, and those in the medical field. These are instrumental tools that we provide our members so that they're better equipped to handle decisions in their lives and their lives themselves. Some of the other topics that we may be talking about is self-esteem and depression. So many of our patients have depression. Either they have a propensity for it, it's in their family, or they're just suffering from that. But when you have GI motility disorders, which are chronic, that can bring on depression as well. These are just examples of some of the topics that go on in these groups. And of course, we talk about the motility disorders themselves. AGMD is very big on educational programs. We cover a wide range of topics within these educational. So we provide articles by doctors, programs by doctors. So we have some of the experts that come on and speak. We have dietitians that speak on various topics related to GI motility, physical therapists. I think the education part is so key in arming patients with what they need, again, in their own personal lives. The more they learn, the better able to make decisions on their behalf. So I think the education is something that we truly do highlight, and we have a lot of articles, even on our website, about various materials relating to GI motility and coping. And I think this is a significant spotlight because, to me, once you have that education, everything else falls into place. The advocacy, the awareness, the making decisions on your part, and the communication, because now you have something to go to an appointment with where you have that key knowledge with you. Advocacy is something that we also cover. And it's not only advocacy with your proclamations, governors, representatives, and senators, but it's personal advocacy, how to advocate for yourself, or if you're a family member, how to advocate for that loved one who is impacted by GI motility disorders. So it's within that medical community, advocacy for yourself, to physicians and nurses. Also, and again, communication goes threaded through all of this. And if you're hospitalized, whether you're in the ER or whether you have a room, it's the advocacy for the patient to be able to explain what they are going through and to communicate in great detail so that the other person will understand. Advocating for insurance issues, appealing various medications that the insurance may deny, or appealing the quantity of medications that may be denied, appealing medical devices or medical necessities. So we try to explain to people how to go about doing that. What are some key tips? Also applying for Social Security. Again, advocating for yourself in great detail, keeping in mind that that person who you are speaking with may not have any idea what motility disorder you have or what a day is like within your daily activities when you're suffering from a GI motility disorder. And explaining again in social relations, explaining your needs to your caregiver or relatives. And if you happen to be fortunate enough to be able to go into a restaurant, explaining to the chefs your special needs or dietary restrictions, and to the service providers, telling them what your dietary requirements are, and how to explain to coworkers if you are able to work. How much do you tell? What do you tell? And should you tell? All of those we give guidelines for, and even explaining to friends, because perimeters can get very small and isolating for the patient when friends at first may be talking to you, inviting you places, and then when you have to cancel at the last minute or postpone things, those friends begin to stop asking you until finally they're not your friends anymore. They've gone on with their lives. So these are some important things that patients go through. And we, again, give some helpful tips and guidelines to help the patient. We do provide awareness programs, especially the August virtual gastroparesis awareness programs that we've been doing for several years now. These take place throughout the month of August. And again, we have world-renowned experts in gastroparesis specifically, who talk about various aspects of the disorder and some of the latest research being done and some of the basics. What is gastroparesis? What are some of the symptoms? How is it diagnosed? And some of the treatments that are going on. There are other ones that we try to highlight, like IBS month and reflux. So this gives an idea of some of the programs we do. We do a lot of virtual now. We used to do many more in-person programs, but since COVID, we've kind of cut that down, and especially with this being the flu season, we've really cut down to just about everything being virtual. And also a note about that advocacy, we are just so grateful to the IFFGD, who is doing an awesome job advocating on behalf of all GI motility sufferers. And they have done an amazing amount of work behind the scenes, bringing even organizations like ours together to really make an impact on the government and bringing highlight to these motility disorders. The AGMD provides recommendations to books, clinical trials. We have some listings of where to get or how to get financial assistance. We have information sheets on some of even going into the school, pediatric and adult ways of navigating through the medical system. And of course, other which we highly recommend. AGMD provides the AGMD Beacon of Hope e-magazine. In this magazine is a compilation of many things. So it not only has articles by medical and dietitian and physical therapy, all those experts, but we also have articles submitted by patients and family members. In addition, we have poetry submitted by patients. We have photographs and artwork by patient members. We have photos of patients and families and pets, because pets are such a huge thing. They offer so much support. We highlight dental problems, and it's such an excellent resource of information. We encourage people to submit articles and other materials. So there's a wealth of information in there, and that can be obtained on our website. Inspiration is really highlighted also within our organization. And so patients and family members who have endured their lives with these motility disorders, we like to, again, highlight these people who really have learned how to turn their lives around or integrate their motility disorders into their lives in such an inspiring way. It's always so heartwarming and encouraging when other people hear the successes of what other people have done and what they've overcome within their process of living with digestive motility disorders. AGMD has a motto, and it's serving as a beacon of hope to those in need. We want you to be able to reach out to our organization. We are here for you. If you'd like to connect with us, you can visit our website. And just a little side note, our website is being overhauled. But we do have a lot of information on our website, including videos and audios by experts and also by patients and family members. We have articles. We have our e-magazine up there. I would recommend that you take a peek. We have that database up there of neurogastroenterologists and motility physicians or experts. We have a listing of clinics and hospitals, specialty centers that have GI motility disorders. In addition, we have a database of nutritionists, dietitians who specialize in GI motility. Our website is www.agmdhope.org. Email is info@gimotility-agmd.org. Our Facebook page is www.facebook.com/GI motility. You can visit our Instagram at www.instagram.com/AGMDHope. Our LinkedIn site is www.linkedin.com/GI motility. And we are on X at www.x.com/GI motility. We also have an Inspire page, which is AGMD. So it's inspire.com/AGMD. Please don't hesitate to reach out. Once again, we'd like to thank the IFFGD, not only for the tremendous work they are doing, but for inviting us to participate in this opportunity to talk about the Association of Gastrointestinal Motility Disorders, or AGMD. Thank you so much.
My name is Stephanie Nguyen, and I am a Crohn's survivor, which is a form of inflammatory bowel disease. Because of this condition, and because I wasn't properly diagnosed, I lost 2 children. This condition has changed my life and has really taken a toll on my health. Going through this journey, I realized that I'm not the only one suffering in silence. And so that is why the Stephanie A. Nguyen Foundation was founded, so that we can remove the health and financial disparities in the underserved African American communities and other marginalized populations. Imagine not being able to go to the grocery store or go to family functions or travel with your friends. Imagine being confined to your home all the time, or being afraid to even date because you have this chronic illness. Our goal at the Stephanie A. Nguyen Foundation is to help build a blueprint for IBD patients who have Crohn's disease or ulcerative colitis, help them get the diagnosis right the first time, not the 5th or the 6th time, so that they can live a quality life and have better health outcomes. So with this journey, what I found, we need community partners to partner with us, to come together, to build, to move our mission forward. And in order to do that, we have 3 ways to do that. Our annual golf tournament, we have our Let's Talk IBD Health and Wellness Symposium, and then we also have our Exploring Health Equity Beyond the IBD Diagnosis Lunch and Learn series. Our goal is not just to talk about awareness, but to truly provide impact and tools and resources for this community to build a better quality of life so that they can have better healthcare outcomes. We also want to teach the IBD community how to advocate for themselves, so when they go to the doctor's office, they truly understand their diagnosis. Imagine going to the doctor and they diagnose you with ulcerative colitis or Crohn's disease and you have no clue of what that means. So I'm asking you, healthcare organizations, gastroenterologists, mental health therapists, diet and nutritionists, we need your help. We need to partner so that we can move this mission forward, and together we can make a difference in the lives of this underserved community.
Hello, and welcome back. The final segment of our day is going to be talking about the legislative priorities of the gastrointestinal illness community, as well as how you can take these priorities to Washington and discuss them with your congressional offices. First, we're going to start with what the priorities are. Now, the list that we are giving you today is just a small sample list of the many issues that Congress is looking at today. These are ones that are specifically of interest to IFFGD, and we're going to share those with you. If there are other things that you find important, things that you want to share with us, please do. At any time, you can email us at advocacy@iffgd.org. Now, it will appear that I'm giving you a lot of information in a really short amount of time, but don't worry, these priorities is laid out in the documents that have already been emailed to you if you pre-registered for this event. If you did not and haven't received them, you can download them from our website or just email us at advocacy@iffgd.org and we'll email them to you. So let's get started. So we can bunch all of our priorities into a couple different buckets. The first one is medical research funding. The second one is patient access to care. The third is about medical nutrition and the legislation around that. Then there's education and awareness. And then there are other topics that you can discuss with your offices. So let's start with medical research funding. So medical research funding is really important because that is how we move that needle forward to cures and bigger treatments for ourselves and our loved ones and for the future. Here at IFFGD, we support funding increases for the National Institutes of Health. And within the National Institutes of Health, we support proportional increases for the National Institute of Diabetes and Digestive and Kidney Diseases, which is the NIDDK. Earlier today, you heard from Griffin Rogers, who talked about the NIDDK. And this is the institute within the NIH in which he is responsible. So that is for general research funding. We also support the research programs of the Department of Defense and the Veteran Affairs Administration. Both of those have very strong portfolios in gastrointestinal disorders. A lot of that is around the Gulf War Illness Research Program, which we find be extremely helpful to our veterans and understanding better how this has affected their GI health. And knowing that the DoD and the VA is prioritizing these items, we do support funding increases for them so that they can continue this great research that they are doing. The second bucket is patient access to care. So as patients, we all know that there are often roadblocks that we find when we are looking to have a test done or maybe a certain medication for us. And so we work hard here at IFFGD to support limiting out-of-pocket payments from patients that are unnecessary. There are many ways in which insurance companies and pharmacy benefit managers are able to sort of change the game. And some of those things that you may be familiar with, we'll talk about today, from step therapy, copay accumulators, non-medical switching, when your insurance company decides to switch your prescription without even consulting you or your doctor. There are many different issues. There are a couple specific ones that we are really interested in focusing our attention on. There may be others that you are concerned about. Please bring those up with those legislative offices if you want to. But the ones that I want to talk about today are the 340B drug pricing program. So this is a program that was created several decades ago. And the idea behind this is that there are certain hospitals that service patients who have lower income and harder to come by resources. So the 340B drug pricing program allows those particular hospitals to purchase pharmaceuticals at a lower price point so that they can pass that discount on to the patients that they are serving in their hospitals. We support this program. Now, we understand there's a lot of controversy right now about it, but we believe that the heart of the issue is that this program is really, really important to so many people that really need those medications and can't afford it. So we support this drug pricing program and hope that our congressional offices will understand the need to continue servicing patients in this fashion. Another area with patient access to care is colorectal cancer screening. So there's two issues that have come up here. One is that, as you may know, there are many different options for colon cancer screening today. Used to be colonoscopy was the only way, and it still is considered the gold standard. So it is the one that you would get to really firmly diagnose that you have colon cancer, to take biopsies of those polyps to make sure that they are cancerous before treatment is begun. But oftentimes people will do a blood or fecal test before that as a screening option. And insurance companies cover that as their colon cancer screening option. However, sometimes they only allow one screening per year or every so many years. So if that screening comes back positive, then your doctor's going to want you to have that colonoscopy, right? They're going to want you to get that biopsy. But insurance companies sometimes don't cover that. And so it is a huge out-of-pocket expense for people, and it's something that we definitely want to fight against, because if you are screened positive through a blood or fecal test for colon cancer, then you need that colonoscopy, and price should not be a barrier for you. The second issue with colon cancer screening is many of us in the GI illness community have issues with nausea and vomiting. We have early satiety, upper pain in our abdomen. And when preparing for a colonoscopy, the hardest part is often the prep. Drinking up to 4 liters of fluid the night before your colonoscopy can be impossible for some people in our community. There are other options available. There are other what they call low volume preps. These have pills that you can take, and maybe just one bottle of water at a time, and still yield the same results for your colonoscopy. Unfortunately, not all insurance plans will cover these, and we want to make sure that they are included, that people do have access to these alternative preps so that we can make sure that more people are being screened for colon cancer and make sure that everyone has that opportunity to be able to have that screening when their doctor deems that it is necessary. So let's talk about some specific legislation that we've been following for many years here at IFFGD. One of those legislations is called the Safe Step Act. And I think for those of you who have been following our legislative agenda for a few years, you might be familiar with this. So the Safe Step protocol is when you and your doctor sit down and you've decided upon a medication that is going to be right for you. And then you go to the pharmacy and it is denied. Sometimes you don't pick up the phone and ask why, and if you don't, you may not know. But sometimes what you'll find is you're actually not being denied because the drug isn't covered by your plan. You're being denied because in order to cover it, they want you to fail on other medications first. So there may be some over-the-counter medications they want you to try, or maybe a different prescription, one that you and your doctor discussed and decide that wasn't the one for you. But in order to get the drug that your doctor says is what you need, you have to go through all of these steps, get these little check marks in your chart to show that, yes, this is the only option left. And this can be problematic. This can be extremely problematic for people who really, they've tried those before. They know they don't work. And having to go through that again just endures their suffering, their quality of life. And then there are cases where, especially in the inflammatory bowel disease, where patients have severe damage to their intestines because they are not getting the medication they need first. They're having to wait. And in waiting, they could cause some serious damage to their bodies that is irreversible. So the Safe Step Act is a piece of legislation that has been introduced the last couple congressional sessions. It has not been introduced as of yet in this session. However, we hope that it will be. And what this does is it puts specific parameters in place for insurance companies that they're going to have to respond with a certain number of hours, and they have to make sure that they are really following a very clear and transparent process so that they do have a safe step process in their insurance plan, that it is easy to navigate and quick so that you're able to get to your medications faster. The second piece of legislation that is important to our community is the Help Copays Act. So copays, as you may know, are those cards that you get in your doctor's office. Sometimes your insurance may have denied your prescription because they actually don't cover the medication. And then the pharmaceutical company that developed that medication wants you to have access to it, so they give you what's called a copay card. And what that means is that copay card may be $25. You're going to pay that $25 copay, and the pharmaceutical company is actually going to pay cash for the rest of it. So they're going to cover part of your medication for you and pay that on your behalf. Unfortunately, in recent years, insurance companies are not counting those payments as part of your out-of-pocket expenses or your deductible for your insurance plan. Now, that becomes problematic because what ends up happening is they're not counting it, but they're getting the money. And then they're still requiring you to meet your deductible. So by the end of it all, sometimes they're getting up to twice as much money than they should be for the deductible. And this is especially problematic for people with extremely expensive medication that is life-saving, and they need it. Unfortunately, they either have to continue with the deductible, or they have to choose not to take the medication when the copay cards run out. So this is something that we've been working on in the past couple congressional sessions. It's called the Help Copays Act. Again, it has not been introduced in this congressional session. We hope that it will be. And definitely these are two pieces of legislation that you can urge your congressional offices to consider co-sponsoring themselves or signing on and supporting once it is introduced into the House or Senate. Another area for patients is medical nutrition. So many of us, especially in the GI community, have specific nutritional needs. And sometimes insurance coverage doesn't cover these medical nutrition therapies that you may need or be required for yourself. So there are two different legislations regarding nutrition that have been introduced in the past congressional sessions. The Medical Nutrition Equity Act ensures that both public and private insurance companies are going to cover medically necessary foods as a treatment option. So it will be part of your plan. It could be part of your prescription benefit or not, but it would definitely be considered part of coverage, where if you are prescribed a medically necessary food, they would have to cover that as part of your plan. Now, the other part of being suffering from a GI illness often is just understanding nutrition. And so many of us want to work with a dietitian. Hopefully, if you are able, you do. And you'll see that in a lot of what IFFGD, when we write our fact sheets and things for our website, we will often say that you should think about your diet and that you should talk to a dietitian, especially one that has been trained specifically for patients with gastrointestinal illness. Unfortunately, not all insurance plans cover dietitians. And so the Medical Nutrition Therapy Act actually provides Medicare Part B coverage for outpatient nutritional services. And so right now the bill is written only for specific conditions, but more can be added. And so we're trying to start somewhere with this legislation and then expand from there. The Medical Nutrition Therapy Act has not been introduced this session. So again, these are two more pieces of legislation that you can talk to your congressional offices about either sponsoring, so they introduce it, or that they are supportive and sign on once it has been introduced in either the House or the Senate. There are many other legislative issues regarding patient access to care. Some have bills already, some do not. Any of these issues that are affecting your life, you should discuss those with your legislative offices. But these were just some specific ones that we are following closely here at IFFGD. Another thing that we're very supportive is education and awareness. Education and awareness are two of the core pillars of the International Foundation for Gastrointestinal Disorders, so it makes sense that it's part of our legislative agenda. Specifically, we support meaningful funding increases for the Chronic Disease Education Awareness Program that's part of the Center for Disease Control and Prevention, or the CDC. This is a new program that started less than 10 years ago, and what it allows for is a bucket of funds which can be tapped into by different disease states. So at the CDC, they have congressionally mandated education programs. So there's certain disease states that Congress has said, CDC, you have to do education awareness about this disease state. But what about the rest of us? So a bunch of nonprofits got together, those that service patients, and said, we'd love to be able to tap into some resources, even if it's just for a couple years, to do an education and awareness program for the patients in our community. Congress agreed, and it was written into the appropriations several years ago. What this is a program that allows organizations to apply for funding in 3-year segments. So it's a 3-year grant, and you get a little bit of money every year to work on specific education and awareness programs for a specific disease state. Of course, if they don't have meaningful increases to this, then they're not able to add more diseases as they go along. So we're very supportive of Congress allowing a little bit of more money every year, so more than just 1 or 2 diseases can have education awareness, but that in the end, hopefully we all can. So this is something you can mention to your congressional offices. Now, there are other things that you can talk about in your congressional sessions, and let's talk about those, because Congress, as you know, is in charge of all the governmental agencies. They're in charge of the CDC, of the NIH, the FDA, and they oversee these. So maybe you have an issue that you want to discuss with your congressional office regarding the Federal Drug Administration. You can do that, and you should. Specific examples: drug approval or denials. If you feel that a drug approval or denial was unfair or something that you want to find out more about and get a little more transparency on, talk to your congressional office about that. Also, access to medications. Currently, there's an issue with the gastroparesis community right here at IFFGD. There was a drug called domperidone that was approved through the FDA through very specific regulations and applications. But that program ended this year with no sight of when it might come back. These are things that you can talk to your congressional office about. Ask them to find out, what is the FDA doing? Are they looking for another supplier? Is there something that they can do to encourage the FDA to help you get access to your medications? Another thing that has been very, very much on everyone's mind this year is some of these executive orders that you are hearing about. And I hear people that are concerned about different ones. And if they truly concern you, or maybe you truly support it, you should tell your congressional office, because what happens, of course, is that Congress has to decide, each of these members independently and as a unit, how they're going to react to these. And so if they don't know what you feel, they don't know what to do. So as members of their constituent base, you need to talk to them about that. One specific issue currently in the medical community has to do with medical research and a executive order that has capped what's called facilities and administration at 14%, which is much, much less than where it currently stands. And there are quite a few people that are employed by academic institutions funded by medical research at the NIH that are very concerned about their jobs and about their livelihood. There are many patients that have been part of clinical trials that could possibly be ended abruptly. And so if these are areas that are of concern to you, any of the executive orders or any of the issues that you hear going on, talk to your congressional office about it. Ask them to look into things that you may think is, there's a rumor I'm hearing. This is something I've heard. Can you look into it for me and get back to me? Tell me what you find out because it concerns me. That's their job. And unless you ask, they won't do it for you. So make sure that you are talking to them about anything that deals with Washington, any of the government agencies that you feel like you have concerns with, praise for, or questions about. Ask them in your emails when you call them, or if you travel to the Hill when you sit down with them. But make sure that these are some areas that you're also thinking about. It's not just legislation that we want to discuss. We can discuss anything. And so keep that in mind. Now, like I said in the beginning, these are just some of the issues that face us. There are many more, and we can't really address them all in this one short video. So I've kind of given you a highlight of IFFGD's legislative priorities. If there are other things that you feel should be on our agenda, let me know. Email me at advocacy@iffgd.org and let us know. If you have any questions about anything I talked about today, email us and we'll get back to you with some answers. But most importantly, this is just IFFGD's legislative agenda. Your legislative agenda is yours. It is what is important to you. It's the things that impact your life, the lives of your loved ones and your friends. Make sure that that is the focus and the priority and what you're thinking about. So before we head into the next session of the day, I want you to take a little time in our short break to really think about these that I've mentioned in this short segment, and also other things that might be weighing on your mind. Begin to jot down a list of your own legislative priorities. What is your legislative priorities? Write those down. Think about those. And in the next segment, we're going to talk about how you can take those priorities and discuss them effectively and efficiently with your congressional offices. In the meantime, contact us if you have questions, comments, or suggestions. We'd love to hear from you. But for right now, get that list together and we'll be back shortly. Welcome back. Thank you for joining us at the 2025 Advocacy event for the International Foundation for Gastrointestinal Disorders. My name is Cecile Rooker. I'm the Executive Director and President of the organization. Today, we've been discussing ways to advocate for ourselves on the Hill. We discussed legislative priorities facing the gastrointestinal illness community and other items of interest of things that you might want to discuss with your congressional offices. So in this segment, we're going to actually talk about contacting your office. We're going to talk about how to find out who your congressional offices are, as well as how to prepare your story and prepare for that visit. So in Congress, there are two branches. There's the Senate side and the House of Representatives. On the Senate side, you have 2 senators per state, and on the House of Representatives side, you'll have one congressman or congresswoman, and that will be dependent on what district you live in within the state. To find that out, you're going to go to www.house.gov. In the upper right-hand corner, as you see here, there is a search box where you're going to enter your zip code. For the IFFGD corporate offices here in Mount Pleasant, South Carolina, we have Nancy Mace. As you can see, there's a map of our district on the right-hand side. There's a headshot. Beneath the headshot, her name, which is in blue. And then these little buttons at the bottom on ways to contact her. Now, if you select her name, which is in blue, it will take you to her website, which you can see in the bottom left-hand corner of your screen. This is Nancy Mace's actual website. On her website, you can find out all kinds of information about her, her legislative priorities, the things that she's accomplished, the things that she's done, and the things that she's working on. And then also you'll see the word contact at the top of the page. That is the page that you will go to actually find out how to contact her. So whether you're calling her or you're emailing her, that information will be on that contact page. That contact page will be different for each representative within Congress. So each senator, each Congress person does have a different design on that page, but they should include all basic information, which is going to be the address and phone number for their offices that are within the district, and they may have more than one, depending on how big their district is. Also, the address and phone number for their offices in Washington, D.C. And then also a contact form, probably, where you can enter and have them call you back. You'll find that on the contact page, and you'll be able to contact them. Now, if you live in a state and you're sort of between a couple different districts, 2 or 3, you may have more than one congressperson that represents a zip code. So then what you want to do is when you enter in the zip code, it's going to take you to this page. This page shows you the different options of who might be your representative. When you enter your street address, it will narrow it down to the exact person who represents you in Washington, and it'll take you to the same page I just had you at before, which has the map of the district, the headshot, and the name. Make sure that you read up on your representative through their website from that page. Now, for the senator, it's a lot easier because there's only 2 and we all share, right? So on the right-hand side, you'll see the webpage, www.senate.gov. And to find your senator, you're going to look at the left-hand side of the page instead of the right, and there's a drop-down menu. On that drop-down menu, as you can see in the lower corner, you're just going to select your state. Once you select your state, this page will come up. This page will show you your 2 senators. For South Carolina, it's Lindsey Graham and Tim Scott. Here, it's a little bit different than the House of Representatives side. Their name is above their headshot, first of all. Again, same rule applies. If you click their name, you'll go to their website. Underneath their headshot, you'll see the word contact. If you click on the word contact, it will take you directly to the contact form on their website. So you won't have to navigate through. You can just hit the word contact and it takes you straight there. Although I do strongly encourage you to go through their website and read up about them. So once you know who your 2 senators are and who your congressperson is, and those are the 3 that you want to contact, you need to start talking about what you're going to do. So it doesn't matter if you're calling or emailing, the script is kind of the same, right? So first you're going to introduce yourself, who you are, where you live. You want to talk about IFFGD. Let them know that you're there as part of the advocacy event for the International Foundation for Gastrointestinal Disorders, and you're there on behalf of the gastrointestinal illness community. And then you want to share your story, and we'll talk a little bit more about what that entails in a minute. After that, you want to talk about those 2 or 3 legislative priorities that you've settled on that are important to you, and make sure that you talk about them and include those asks that we mentioned as well. Following that, you will ask them for their email address if you're calling them, so that you can email them the legislative packet. If you have emailed them, then you will have already attached it. Now, remember before you get off the call that you might want to ask them if they have any questions, because they might. And if they do, make sure that you answer them. If you don't know the answer, that's okay. Contact us at IFFGD, and that email address is going to be advocacy@iffgd.org. Let them know what their questions are. We can either respond to them on your behalf and copy you, or we can give you those answers so that you can email them yourself. Finally, and most importantly, make sure you thank them for your time. So these people have busy schedules and they talk to a lot of people. So make sure that you let them know that you appreciate them taking time out of their day to listen to your story, listen to your requests of their boss, and hopefully pass on those requests to the boss and discuss it with them so that we can see action made from your call or your email. Now, looking at each of these items in a little bit more detail, let's talk about the legislative agenda. So if you have pre-registered for this meeting, then we will have already emailed you IFFGD's legislative agenda. That includes our issue briefs, and then you will also receive email templates that will make emailing them a lot easier. So if you want to email them, it'll be all templated for you, so you can just insert your story, insert what's important to you, what those asks are, and then close it out in your own personal way. If you have called, then you will take this material, like I mentioned earlier, and you'll email it to them. If you have not pre-registered for our event, thank you for joining us. We appreciate you. But what you can do is you can email us. Again, it's advocacy@iffgd.org, And we will email you these materials so that you can have them for when you do send your email or you follow up from your call. Now, regarding the legislative agenda, make sure that you answer your own questions before you contact them. So if you have questions at all, email us and let us know, and we will help you to prepare yourself so that you aren't going in there sort of not sure what you're talking about. We want to make sure you're comfortable and confident when you do decide to put pen to paper or stroke on that keyboard or make that call. And make sure, of course, again, I can't focus this enough, that you focus only on those legislative issues that are very, very relevant to you, that are important to you, the ones that you really want to advocate for. Make sure that you don't try to become an expert on them because you don't need to be. Honestly, the staffers aren't going to be either. They need to understand how it affects your life, and then it's important, and they will learn basic things about it, and they will learn a lot about it. But the experts are the people that wrote the bill, and they're the only ones that need to be. Just make sure that you have your questions asked about those things and that you focus on being the expert of what you are an expert of, and that's you, your illness journey, and your story. So let's take a moment to talk about your story. So first of all, if you're on the phone, you want to keep your story to about 3 to 4 minutes. And you can do this you can write it ahead of time and read it back, see how long it takes you. You can share it with a friend or a loved one to make sure that you are being clear and concise, but also thorough. You're not leaving anything out. And that, you are really talking about the things that are important, how your illness has affected your life. And then make sure that you tie that in to your asks when you finish your story, as we mentioned earlier. Now, if you're really kind of struggling about what to say about yourself, I know it's hard. Sharing your illness experience makes you very vulnerable, and it's difficult to do. So here are just some things to get your wheels turning. You don't want to talk about all of these, and you don't need to talk about them all, but just some things to think about. Like, first of all, what is your condition? Do you know? Do you have a diagnosis? Tell them that. Tell them a little bit about it. If you don't know, express that to them as well. Are you in the middle of a bunch of tests trying to figure it out and you're struggling because medical research just hasn't got us there yet? Let them know. Does it affect your daily life? How does it affect your daily life? How does it affect your relationship with others, your work, your social life, your family? When were you diagnosed? How long ago? And, how long did it take? For some people with GI illnesses, it could take up to 15 years to get a definite diagnosis for their condition. And that's terrible. And that shouldn't happen. And Congress needs to know. And then, if you want to, you can talk about how you manage your condition from day to day. A life in the day of me. This is what I have to do every day just to be able to make it from sunup to sundown in some sort of semblance of normalcy. These are all the things I have to do just because of this illness and how it is affecting me. You can talk about how it's changed over time, gotten better, gotten worse. And if it's something that has compelled you to advocate and you want to talk about that, that's another thing that you can weave into your story and you can talk about if that's important to you. So like I said, these are just some little hints, some things to get the wheels turning in your head so that you can write your own story in your own way, in your own words, focusing on the things that are important to you. Okay, so we've done our story, we've done our call, we've sent that email, we're really happy with it, we feel confident. What do you do next? Well, it doesn't stop. It's 2 things that you need to do. Most importantly, 1, email us and let us know, because we want to know that you called, who you contacted and who you talked to and what you discussed. We like to follow up with them and be able to say, so we had someone in our community that talked to you about this particular topic, and we're just following up to see if you need any more information. We want to follow up and see what they did. We're just going to get that sort of like 1-2 punch, like kind of back you up a little bit. So please let us know that you contacted them. Secondly, make sure that you contact them. Make sure you contact them if you've done a phone call, thanking them for their time, attaching the legislative packet. If you've emailed them, if you haven't heard back in a couple weeks, email them back. Follow up with them continuously if you need to until you get the answers that you need. So make sure that in all things that at some point you do email that legislative packet to them. It gives them all the information at their fingertips so that they have that information readily available. and consider us a resource if you have any questions. And of course, please, please, please let us know that you did advocate, that you did call or email so that we can champion beside you. Some things to keep in mind. And of course, this is always important. Make sure that you focus on the priorities that are important to you. Like I keep repeating, make sure that you share your personal story very concisely and very informally in a way that you're comfortable. And make sure that you remain calm and positive, and make sure that you enjoy the experience. So don't talk about things that are gonna maybe make you uncomfortable. You don't have to do that. Okay, make sure that at the end of the call you're confident and you're happy that you did it and that you know that you're being heard. So don't do anything in the call that's gonna take you outside of that realm of comfort. So do all the things that make you really feel good about yourself. Now, what do you not do? Please don't try to stress over the material itself. You're not going to be an expert, like I mentioned before. Also, remember to take time with your story, because that story is important. So don't just say, I am Cecile Rooker and I have 3 GI illnesses. It's important. Let's talk about this legislation. Talk about yourself. Let them know how it affects you. And remember to stay emotionally detached from any negativity that might come up in the call. Don't get in an argument with the staff or feel any sort of tension. Just hang up. Just end the call if that becomes the case. And make sure that you are not sharing any personal information that you are not comfortable with. Again, I can't stress that enough. Make sure that you're doing what you're comfortable with so this is a positive experience. That was kind of a quick overview of how to find your representative and how to do that phone call or that email. But just remember that this is a personal experience and there are many ways that you can do it. This is just one suggestion that we have to make this process easier for you. The important part is that you are comfortable and confident. Second important part, that you're telling your story about things that are important to you, and that is about you, and making sure that you are using your voice so that you can be heard in these congressional offices. Because if all of us have our voices heard on Capitol Hill, we can make a difference. The squeaky wheel gets the grease. If enough of us are causing enough squeaks, then they have to listen. So please, please, please join us. Please contact your legislative offices. Contact us if you have any questions. Contact us for support. We're here for you. We want to be a resource for you so that you can find your voice. Find your voice so you can make a difference. Again, thank you so much for joining us today in this program, the IFFGD Advocacy event for 2025. We hope that you will take that time to contact your congressional offices. We hope you've given you some materials that will help make that easier, and that we've given you some ideas of things that you might want to talk about. Thank you again, and we appreciate your time. Hello, and welcome back. This concludes our programming for the 2025 Advocacy event for the International Foundation of Gastrointestinal Disorders. Again, my name is Cecile Rooker, and I'm the President and Executive Director for the IFFGD. Today, we brought to you information from the NIH, from 2 patient organizations that are available in the nonprofit space as resources for you. And then lastly, we concluded our program with information about actually directly advocating for yourself in Washington, D.C. In this year, 2025, it's been a really wild ride in Washington. It's April, and the first quarter of the year, there have been a lot of changes and a lot going on. And we hope that we've been able to help you to understand some of the legislative priorities for IFFGD. They're really long-standing, and although there are things going on in Washington today, remember that your congressional offices are here to listen to you. So if there's something that you hear that concerns you that has not been mentioned in the program, please bring it up on your call. We do hope that you will join us in making an effort to contact your congressional offices. We hope that you will advocate for yourself and others in the GI illness community by doing so and letting them know the needs of all of us in the GI community, but most specifically, your needs. If you have any questions at all before you contact them, questions about anything in this program, any of the talks that you heard, contact us. Our email address is iffgd@iffgd.org. Email us at any time. If you are having issues navigating your healthcare and you need some assistance, email us. If you need someone to talk to, email us. If you're looking for a dietitian or a behavioral therapist, a doctor, email us. We're here for you as a resource. We also have many educational resources on our suite of websites. Our primary website is iffgd.org. From there, you can visit any of our other 12 websites. We have disease-specific websites such as aboutibs.org, aboutgerd.org, about gastroparesis.org, and many others. There's even one just for pediatrics. So please check out our websites, see our resources, and if you have any questions at all, email us. This concludes today's programming. Once again, I have to thank our supporters for this program: Pfizer, Takeda, Fathom, Sabella, and Ardelyx Pharmaceuticals. They were instrumental in providing the resources needed to be able to bring this program to you today, although they had no involvement with the content. Thank you so much for joining us. We hope that you will join us again next year when we have our next advocacy event, and that in the meantime, you'll contact us. Say hi. Let us know who you are, how you're doing, and how we can help. Again, my name is Cecile Rooker, and I really appreciate you joining us today. Thank you.